Governor Kevin Stitt has extended non-essential business closures to all 77 counties. That was in a press conference he had Wednesday afternoon. I'm joined now by Carmen Forman, who's been covering the governor and all things going on at the Capitol. Carmen, how are you?
I'm good. I'm not at the Capitol these days, though.
You know, it's become one of those, and I think you tweeted this, it's become kind of must-see viewing when the governor has a press conference.
Yeah, it's really funny because, my roommate from college texted me that she heard my voice on there once. And then my boyfriend's mother, she watches the press conferences. So it's like all these people that are now so fascinated with sort of what my job is, watching the governor.
You know, it's interesting too, because you watch the comments on the Facebook page. Governor Stitt hosts these press conferences on his Facebook page. And people are commenting like, this isn't starting at 3:00. I thought it was press is known for a long time. Press conferences start when press conferences start, right?
Yes, almost always late.
It's a glimpse behind the scenes for everybody, but let's dive into it. We did hear a few things in this press conference today.
Hello, Oklahoma. I wanted to give you an update on a number of things we've been working on.
He lifted some restrictions about who could be tested.
Yeah, that was really interesting because before the state was saying, if you're a vulnerable population, if you're immunocompromised, if you're higher risk for COVID-19, then you should absolutely be tested. If you're a healthcare worker or somebody on the front lines in the hospitals, you should absolutely be tested. But in a reversal today, Governor Stitt said basically that they have so many tests that nobody should be turned away from a COVID-19 test if they are exhibiting symptoms of the virus. So that was really interesting.
Yeah, he said they can process the tests in state now, and I'll let you tell us what you heard. But he also mentioned more drive-through locations and more testing facilities around the state.
Yeah, I think he said they have 6 mobile testing sites right now, and by the end of the week, they want to get that up to 13. We obviously have private facilities doing testing. The State Department of Health is doing testing. And you may have to correct me on this number. I know you were listening in, but I think I heard that we have something like 13,000 tests right now, 13,000 available tests.
He mentioned that there were now 13,600 test kits available.
Yeah, it made my eyes pop.
Some models and predictive analysts that are showing spikes. In early April, we've seen late August, and kind of everything in between. It's kind of like predicting hurricane forecasting. The farther that hurricane is out in the ocean and away from land, you have the cone of uncertainty. You've got just really, really wide. As we get more testing, as we get more data, that cone of uncertainty will start to narrow, and we'll have a more specific focus. So we're looking at many scientific models. IHME is a model the White House has referenced in recent days, along with, the Department of Health has their models. Oklahoma State is also looking at several different models that they're informing us with. The numbers fluctuate based on those models, but the model that we're focused on right now when we look at everything is a kind of a late April peak is what we're planning for.
Also, he mentioned something that I hadn't heard before, the term cone of uncertainty, that they're looking at different models of how coronavirus might peak in Oklahoma.
Yeah, I thought that was really interesting because he used a hurricane metaphor as opposed to, say a tornado metaphor, since we are in Tornado Alley. But what he was basically talking about is he's been working with experts, some at Oklahoma State University, State Department of Health, and they're trying to get a sense of when coronavirus is going to peak in Oklahoma. And that will give them an idea of when the hospitals need to be prepared with the most PPE, the most staffers. And he said today in the press conference that they expect the peak to happen sometime in late April. But he also said that there's a certain amount of uncertainty around that because there's no one way to model when this virus could peak. And so they've looked at models that have shown this could peak as far away as in August. And so that's where the sort of cone of uncertainty comes in, is because I guess it's also similarly hard to model when and where hurricanes are going to hit. So he sort of made a comparison there.
Something else we heard, he mentioned upcoming announcements. Tomorrow he mentioned for a surge plan and to build more hospitals.
Yeah, that is interesting. From what I've heard, the Army Corps of Engineers is surveying alternative sites that could be used if additional hospital beds are necessary. And I know we've seen that in places like New York, where they're turning the Javits Center, which I think to, basic folks who don't live in New York might be most famously known for where Hillary Clinton lost the election. They turned that into a makeshift hospital with just, tents and beds lined up one right after the other. And so the Army Corps of Engineers is looking to do the same in Oklahoma, if necessary. So they're looking at places like the State Fairgrounds, the Chesapeake Arena. I'm sure they're looking at places in Tulsa as well. So we'll know more about that soon, it sounds like.
We're talking about the press conference Governor Stitt just held on Wednesday, April 1st afternoon. I'm Dave Morris chatting with Carmen Forman. Carmen, one of the questions the media threw his way multiple times, you could tell the governor was like, hey, I think I answered that question, was the shelter in place. You've also done some reporting on a separate story, I guess, some of the businesses versus the health community kind of having a different perspective on how things are going.
Yeah, it's kind of interesting. This crisis has unintentionally pitted, public health interests against economic interests. And Governor Stitt, being a businessman, naturally his heart lies with, small businesses, local businesses. And so the idea of having to just sort of blanket shut so many of those places down, I think it legitimately pains him. And he sort of referenced that in the press conference today, that he's thought long and hard about all these decisions that he's had to make. But the problem is that public health experts are saying, the more businesses that are open, it gives people more opportunities to leave their homes and go out and be near other people, which obviously can potentially increase the spread of COVID-19.
It's a story that will be on the front pages for quite a while. She's Carmen Forman. She's all over it, covering things at the Capitol from wherever she might be able to cover things from the Capitol. Carmen, we appreciate your time. Please stay safe.
Thanks. Bye, Dave.
All right, more coverage from Carmen Forman online at oklahoman.com and, of course, in upcoming editions of the Oklahoman.